Okay, here we are in the social portion of the biopsychosocial. This portion is important not only from a social work perspective as we take the person in their environment, particularly the social environment, relationships, communities, the society in which they live in. This is kind of where social workers live in many ways. And so this is certainly a section that we take pride in as social workers. So let's take a quick look at some factors that we'll want to consider. How does this play into the DSM? Well, there's plenty of diagnoses that have to do with relationships and relational issues, or the impact of their mental health symptoms on their social and relationship functioning. And that's why this category or this section of the biopsychosocial is important. It's not just merely to find out, oh, what hobbies do they have, or do they go to a church, or who their family members are. It's much more than that, because if this really kind of gives us insight into how those relationships are functioning, and if that is tied possibly to the mental health symptoms that they're experiencing. So maybe they're experiencing major depressive disorder, and then all of a sudden we find out that their relationship isn't going so well, or they're not able to go to work, or they don't have many friends anymore because they're isolating. What we can do is we can kind of triangulate, or at least begin to correlate. Oh, okay, so we can start to begin to justify and have it meet the criteria for major depressive disorder potentially, because we can meet some of the criteria of major depressive disorder if we find out, for example, they're experiencing anhedonia. So let's say that typically they've had participated in hobbies or social activities or some things they enjoyed, and they no longer find pleasure or enjoyment in things that they previously did. This section here, this part of the assessment, will pick up on things such as hobbies and their social interactions. It may, again, we can talk about the impact on relationships. Is it impacting social withdrawal, or do they no longer have friendships, or are they getting divorced because of their anger? If you can see, all these things it may seem like, oh, that's interesting, or oh, they're having relationship issues, but it's much more than that. It's potentially, why are they having those relationship issues, or why are they not going to work, or why are they not going out and socializing? It's one thing to find out that, oh, they don't go out anymore, and that's okay, that's symptomatic of something, but maybe it's part of a bigger picture and a diagnosis, that they are experiencing a mental health condition that's impacting this functioning, which is part of the DSM criteria, is functioning in all of the biopsychosocial areas. And this gives us insight into that. So if we look at this area really quick, we can see that it begins with relationship status. So wanting to find out, are they currently in a relationship? Are they single, married, divorced, separated? I would just particularly pay attention to words such as separated and divorced. Sometimes we think about separated and divorced, and we don't get the kind of timeline of that. So if they say, yeah, I'm separated, make sure you say, how long have you been separated? Because there are some people, when we think of separation, that it's been 2 weeks. Others, it's been 20 years. And so finding that out, how long have you been separated? How long have they been divorced? If they've had a spouse died, how long have they been widowed or a widower? How long have they been married? Remember frequency, duration. Those similar things apply to the social aspect of this. You can also find out, who are they living with? And again, are they in a relationship? Go through the names of the children, find their ages out. This all has to do with kind of the age and stage of life. If they have a lot of young kids, that in a clinical world, you're going to have to factor that in. If they're a mom or a dad or whatever of, 3, 4 small children, or small early elementary school age children, that's a lot. That's a lot of stressors. It's a lot of stress. on family. So it's important as a social aspect that we understand the age and stage of life they're in so that we can kind of normalize some of this stuff. We don't want to diagnose everything that may be kind of normal phase of life issues. Find out these areas of the children then, as I mentioned, cover who lives with them, is there custody issues, things like that. That's all important. Next, finding out about some of the people in their family. Ask about their parents. Are their parents still living? Their mom and dad right here. Do they have siblings? Finding out about all these areas of their kind of immediate family is critical. If their parents were divorced when they were young, that's a big factor. That'll tell a lot about that person's psychology and how they grew up. If they've had a parent that recently passed away or is deceased, that's something you'll want to know. Maybe there's some grief or loss issues that you're going to need to cover. Also, finding out about family relationships. As you can see here, this is a great little social kind of little chart here, is finding out deceased, regular contact, infrequent, support, doesn't understand, uses substance with, conflict. This is a cool little kind of chart to figure out what type of relationships they have within all these relationships with siblings, children, whatnot. Okay, let's move down to family of origin that we've spoke about. So actually I kind of mentioned this, kind of jumped the gun. I mentioned that in this section here. Family of origin, so we talked about who raised them potentially. Was it the mom, dad, grandparents? Were there substance use there? Was there any sort of potential abuse when that person was growing up? Physical, verbal, discipline. Sometimes you don't need to cover all of this particular portion in a social history. That can be kind of too quick, too fast for some patients, some clients to get into, and so you may hold back on the whole verbal and physical abuse talk for right now. But you can ask, what was the family of origin like? What was it like growing up? And they'll probably tell you from there. Getting into cultural factors down here at the bottom, finding out what are their cultural factors, which include any sort of spiritual background. These can be very protective factors, or these can also give insight that maybe they no longer participate in kind of cultural, activities or cultural factors that maybe were important to them at one time, and then they drifted away from that. So finding out about spiritual beliefs, religious beliefs, which can and are different. I'll definitely tell patients that are in clients that for some it's going to an actual building and going to a particular religion where they go. For others it's spirituality and belief in a higher power, and that can be nature, that can just be them in their house doing yoga, whatever the case may be. So kind of differentiating between those can be strong protective factors. And as I said, any sort of ethnic or cultural background would be important, because there are certainly cultural considerations you'll want to take into account. This all plays into the DSM as well, as we got to also consider cultural factors. Is this something that might be kind of due to cultural norms or cultural behaviors, and being able to consider that as well. That is at least the beginning portion of the social. We're going to move down to a couple of other areas real quick. Okay, let's start here at the educational portion. When we're finding out about education, this can be very helpful if we just to get an idea of any sort of educational background, high school, any sort of college, less, maybe they didn't graduate from high school. These are all things as social workers we want to find out, because this can tell us or help us know, for example, job opportunities or earning opportunities or level of education, factors that have to do with economic issues or social issues, in the way we work with them. There's a whole bunch of things that go along with education, and finding out kind of that background that even shapes understanding kind of maybe where they grew up and was education even valued. So all of those things can play into the educational portion with adolescents and children particularly, finding out a little bit about these areas of, are they currently going to school? Is there any educational or academic issues with learning? Those things are great to find out if you have any child and adolescent clients, but also for adults, have they had difficulties with learning disabilities or reading or writing? That'll give us some insight. Maybe there's some sort of processing disorder or learning disorder that they've really never discussed with anybody. But that's something that we'd want to know as clinicians. Then we move down here to the employment and vocational. So in this area here, we want to find out, are they currently employed? For example, is it full-time, part-time, side jobs, for example? Find out where their employer is. How long have they been in the employment? You want to talk about their job, whether they're satisfied or not satisfied. And if they're not satisfied, find out, is there conflict going on? Are there substances being used at work? What are some of these other areas? Do you use substances at work? Others use substances. So finding out, not just like, hey, where do you work at, and move on. Find out how many hours, how's the work going, is it contributing to their stress? Because again, these social factors may actually be contributing to their mental health and potential mental health diagnoses because of the amount of stress or anxiety they're under. A lot of jobs come with different stressors. I've had plenty of clients who, for example, may even work on like a production line, for example, and the anxiety that causes somebody to be on a production line. The work can be hard. It's long hours. Sometimes those supervisors are not very nice. The time demands. Anyway, all of that stuff can contribute to their mental health concerns and issues. Then we can move down here to legal. So let's say, for example, a person is awaiting trial, or they're currently on probation, or they're awaiting sentencing. All of these areas down here, it's important to find out for sure up front from your clients, are they coming to see you due to legal issues? That is so important for you. It'll save you a lot of grief and pain if you find out from the beginning if they're court ordered. It's probably even many agencies have policies that they don't take on court ordered clients because of a whole variety of factors. So finding out about their legal status. But I've had plenty of clients that if you're in legal problems, that causes huge amounts of stress, anxiety, depressed mood, which once again, we've always can relate these type of symptoms and distress. We can begin to match up these symptoms back to the DSM as the symptoms that are going on, but this helps put it in a context for us as clinicians, which that's kind of the beauty of doing a biopsychosocial, is it gives us understanding. Otherwise, we would just know like, oh, this person's anxious and depressed, but when we come to find out, oh my gosh, it's because they're awaiting trial and they may be locked up for the next decade. That would certainly do it, and we want to find that out. And then finally down here, financial status. I ask a lot about this as well, just finding out, how are their finances? Are the finances stable? Are they struggling to pay bills? Do they have even basic needs? Do they need help with anything such as food, transportation, rent? All of this, as we know, Maslow hierarchy of needs. People are going to struggle, and people are going to struggle with their mental health if they're constantly stressed out for food, shelter, clothing, and basic resources. So finding out about that helps us, again, kind of triangulate what's going on in their life and what might be contributing to their symptoms. Lastly, down here, this money management, that's kind of interesting. And not just because it's interesting, but for the fact that may play into other disorders. As you can see, being able to, are they able to budget? Do they have gambling problems? Is it compulsive? Are they hoarding money? These can all point to various different diagnoses. If we talk about certain disorders, such as if they're in a manic state, they may have impulsive or inability to budget. They may have impulsive buying, and that's contributing to issues. Maybe they have compulsive spending. Maybe it's more of an OCD type of issues. They just buy, for no particular reason, which then can also go into hoarding. In this case, it's hoarding money. So maybe there's anxiety over not wanting to spend any money. There's anxiety that something's going to happen to them, and so they don't spend any money. And finally, gambling, that's kind of a disorder in and of itself, an impulse control disorder, and even an addictive or an addiction disorder. Gambling definitely gets them in financial issues, but it's also a mental health diagnosis. And so understanding their financial situation is another part of formulating a mental health diagnosis. All right, so all of this leads us then to this last portion, which is beginning to ask ourselves, how are they functioning? Some of the things that I'll ask my clients are questions that surround these areas here, such as how is your daily functioning as far as being able to care for yourself? Do they have adequate housing? Let's see, are they have any needs as far as adaptive or assistive needs? You know, I have clients that have walkers, or they need crutches, or are in a wheelchair, things like that. Finding out about functioning in general functional assessment, I will include kind of daily functioning. So I will ask them about such things as daily hygiene, eating, bathing, being able to take care of themselves, going out, going shopping, being able to budget money, being able to go to work, being able to drive, cook meals, take care of their children. All of those things can be included in daily functioning. And that's critical to formulating DSM diagnoses, because this is repetitive, but going back into it, is it causing distress or impairment in their functioning? And so even asking if they are struggling to, bathe themselves or brush their teeth and have issues or impairment with normal daily functioning, that's something that you'll want to know and document. And then finally, down here at the bottom, this is just a nice kind of ending for a biopsychosocial, is to do it from a strengths-based and resiliency perspective. So during this whole biopsychosocial, in every section, we also should be marking, whether it's putting a little star, whether it's underlining it, we should be marking what their strengths are, as far as family support, desire for help, social stability, resiliency, stable housing, all these things in this area. Maybe they have hobbies, friends, things like that. All of the biopsychosocial areas, we should be looking for strengths and resiliencies. How have they got to where they've got to in life, and how have they made it work? Then we get to needs. What needs do they have at the end of a biopsychosocial? Do they have transportation needs? Do they have medication needs? Different coping skills? Reviewing that. Other strengths or resiliencies that we talk about are such things as abilities. So are they insightful? Do they make good comments? Are they social? Are they kind? Different things like that, different abilities. That's something that we can document and have some insight about, that we can use as part of a treatment plan as far as strengths-based treatment. This last portion, really, it's something that I've never really asked before, but I guess if you're in an agency that does kind of a person independently doing an intake, they'll ask about, male therapists, female therapists, stuff like that. So, all right, this is a long video. You can definitely break it up into segments, but that's a biopsychosocial assessment. We tie all of these symptoms, behaviors, different areas. We need all of this information, because when we go to the DSM and crack it open, we're going to want to then match all of this information up with particular criteria. In all of these areas, it can help us put together this puzzle that we're going to need to know about. So doing a good biopsychosocial will save you a lot of pain in the future, because you will have gathered all this information up front rather than trying to piece it together session after session after session. So doing a good solid intake will save you, again, it'll save you a lot of time and effort in the long run, and it'll make for a much more accurate diagnosis. Doing it from a strengths-based perspective and resiliency perspective, that's also critical and crucial. As I've said before, in each area, please identify the strengths and resiliency factors as you do a biopsychosocial. That's going to be part of your number 3 assignment, I believe. When you do a case analysis, you're going to need to do it from a strengths-based perspective, resiliency perspective, as well as biopsychosocial, everything I've talked about in this video. All right, there you go. It's a long video. Bear with it. But hopefully this was helpful to begin to break down how biopsychosocial can play into a good, solid assessment in formulating a diagnosis.